All right, hello and welcome. My name is Adam Starks, and I am the coordinator for Healthcare for All, Barber County. I want to thank everyone for joining us on this town hall, whether video or on the phone call here. This town hall is one in a series that will be held across the state of West Virginia. We're excited to announce that we now have 4 regional teams working on this campaign, including Cabell, Wood, Kanawha, and Barber County. All right, and more to come. The purpose of our campaign is to work towards a future where West Virginians don't have to struggle and suffer without adequate and accessible health care. I'm sure all of us have a story that we can relate to, and I've personally been impacted by this, and will share my personal story later on. Since the campaign started in January during the last legislative session with community support, we have made a number of significant strides in that direction. So we hope to progress more throughout the year and into the next session. We are here tonight to let you know that we have been working on, what we hope to do, and provide opportunities for folks throughout Barber County and beyond to be able to participate in our efforts to bring affordable and accessible health care to every single person in West Virginia. All right. Most of all, we want to hear from you. We invite you to reach out and share your ideas and your healthcare story to bring real positive solutions to helping everyone receive affordable, quality health care. All right, and to do this, we need a coalition built by a number of committed organizations and people. So I hope after you listen tonight, you'll be willing to get involved. Many of the groups that have been working on health-related issues and policies on behalf of West Virginians include West Virginia Citizen Action Group, West Virginia Center on Budget and Policy, West Virginians for Affordable Health Care, and, of course, our state campaign and local affiliate here in Barber County, Healthcare for All. All right. At this point, I would like to turn it over to our Executive Director, West Virginians for Affordable Health Care, all right, Dr. Jessie Ice.
Thanks, Adam. I am excited to talk about this campaign, but first, while I have you all listening, I want to invite you to take our Healthcare for All poll. Later in this town hall, you'll be prompted to answer questions about planks of the 2021 Healthcare for All agenda. You can participate in a few different ways to take the survey. If you're on your phone, you can be prompted during the call to press buttons and weigh in. You can visit our website, or you can comment on the Facebook live stream, so depending on where you're listening. And one person who answers these questions will be randomly chosen to win a $15 gift card. But you have to take the poll to enter the raffle, so more on that coming up. Now, I'm going to tell you what the Healthcare for All campaign is all about. The Healthcare for All campaign is about making healthcare more affordable and more accessible for every West Virginian. We believe that healthcare is a human right. We believe that people matter more than profit. We know that there is a world that is possible where everyone gets the care they need, and we're pushing a bold agenda of changes at the state level to get there. But it's going to take all of us to make this happen. It's going to mean listening and talking with our neighbors. It's going to mean telling our personal stories. It's going to mean meeting with our elected leaders all year round. It's going to mean holding candidate forums and getting candidates to say out loud that they will stand with uninsured people, people using Medicaid, and all of us who are struggling to afford the care we need. It's going to mean showing up at the Capitol. It's going to mean showing up in our communities. It's going to take you and me and every one of us. That's what this campaign is about. So we're really excited to bring it to you. Now we're going to talk about the local work we're doing in your area.
All right, thank you. Thank you, Jessie, for that. And I guess at this point I can share my personal story and why I got involved with this campaign. I've been fortunate enough most of my adult life to have health insurance, generally tied to my employer, whether that was the federal government or working for a national chain restaurant, and later on with some nonprofits. That being said, I have always been in some sort of debt to medical bills, to the tunes of thousands of dollars each time. Back here in February, I had a pulmonary embolism or a blood clot. I fell flat on my face. I was supposed to be on vacation, enjoying some time with my son on his band trip, and I had to fall over with a blood clot. I spent about 4 days in the hospital down in Daytona Beach, Florida. All right, not the good section of Daytona Beach. I was actually in the hospital. All right, and I came home 4 days later, and a couple weeks later, we were given a bill. The health insurance thankfully covered most of it, but it cost $36,000, to save my life. And thankfully, health insurance covered about $32,000 of it, but that leaves me on the hook for $4,000. And it didn't matter whether it was a child that broke an arm or another one that was diagnosed with Lyme disease, whatever the case may be. We're always paying medical bills, even with health insurance. And so that got me thinking, what about the people who don't have health insurance? I see all of these GoFundMe campaigns, and if it's a close friend of someone, they'll try to help. But obviously, I can't help everyone. Every time someone, is diagnosed with cancer or they have a car accident or something. And that's unfortunate. We live in the richest country in the world, and we are the only industrialized, developed nation that hasn't figured this out. So I'm hoping to be part of a movement that will, take it piece by piece, just like they're doing, celebrate the small wins, but ultimately get towards the goal of having health care for every single West Virginian. All right, and at this point, I would like to turn it over to Emily Starks. She is a family nurse practitioner here in Barber County at Broadus Hospital.
Thank you, Adam. And for anybody who's wondering, yes, I am Adam's wife. So we'll just clear that up to start with. I am a family nurse practitioner here in West Virginia, and I've been a nurse for 20 years, and I am involved in many facets of the healthcare industry. I do inpatient, I do emergency medicine, I do some rehab, nursing home, and wound care. And what I'm coming to talk to you today is about issues with nurse-patient ratios. And I'm sure you're wondering, how on earth can a nurse-patient ratio have any impact on access to health care? But I'm here to tell you, nurses play a vital role in people having health care and having good follow-through and good access to health care, so that they're able to understand what their health care plans are, to understand what they offer. You'd be amazed at how much time a day I spend adjusting medications and adjusting orders based on what health insurances will cover. And at the end of the day, it increases a patient's ability to be what in the business we call compliant, to be able to do the things that are necessary to keep you healthy. There are 3.8 million nurses in the United States, and they do everything from home health services to hospice to inpatient to clinics to offices. I mean, we're everywhere. And our number one goal, what we try to make as our number one goal, is to keep people healthy and give them a good quality of life. Nobody can add quantity of life, but if we can make the quality of your life good, then that's the goal. So the number one improvement to the quality of life that we want is to improve patient safety. And there have been numerous studies that show that nurse-patient ratios, whenever there are safe numbers, and the lower the numbers, the better, especially whenever you're thinking about an ICU patient, it reduces incidence of things like falls, infections, accidental extubations, which does happen in the intensive care unit, pneumonias, medication errors get reduced, pressure ulcers get reduced. So nurses play a vital role in that. And decrease in those kind of complications decreases the time that you may have to spend in the hospital and get back to your home where you're better, where you're healthier, and hopefully, able to be better and have a better quality of life. Of course, then when you add to that, it's just an overall improved outcome. If nurses are able to keep you out of the hospital or provide you with a shorter hospital stay and get you back into your home, then home health nurses come in, or, if you're going to a rehab, the short-term rehab or long-term rehab, they, again, look at your medication lists and communicate with the providers and say, blood pressures have been running really low. Maybe they're on too much medication, or this one's having a lot of pain. What can we utilize to make their pain better so that they're able to have a better quality of life? And at the end of the day, nurses who are not overstressed and overworked have an improved safety in their staff. You have patients that are total care patients that need assistance with things like turning and repositioning, and those patients, they require a lot of care, and it usually takes more than one nurse. Now, fortunately, a lot of places also provide nursing assistants, and they do a ton of work in the care. But, being able to provide that extra care and that extra time, it also helps with things like providing a patient a hierarchy of needs. And when I'm thinking about that, I'm thinking about nursing home patients. If their nursing staff and the CNAs are overwhelmed with being able to provide a patient with their incontinence care and their turning and repositioning, how on earth are they providing for their mental health and their emotional health if all they can do is manage to take care of their physical needs? So that's another reason why nurse-patient ratios are just so critical in caring for patients and providing with everything that they need. It also helps to decrease nursing burnout. If nurses can't get things done in their shift, it gets handed off to the next shift. Those jobs still have to be done. Those tasks still have to be performed. And it's critical that they get done because, of course, it improves patient outcomes. It decreases the adverse events that happen. And, if something gets carried over to the next shift, then it just adds stress. And over time, nurses develop burnout. We get exhausted, and patients no longer become people, and they just become a task. But nurses that are adequately staffed don't see patients as objects and tasks to be done, but they see them as people, and they're, again, able to provide the hierarchy of need. In West Virginia, our biggest challenges to providing adequate staffing ratios are things like transparency. It's very difficult to get hospitals to report their staff-patient ratios for patients, and not having that information makes it very difficult to provide legislation and other kinds of information that would need to be adequately provide the laws that would help to be written. Now, of course, the biggest argument I've heard is, well, if you give a ratio, that's all they're going to provide. But the law doesn't have to say that's all they're going to provide. They can provide more than what is necessary to provide good patient care. The more nurses, the better the patient care, the better outcomes, the better safety, the less adverse events. It all ties in together. Nurses get into the field by and large because we love patients and because we love people and we love caring for people and helping them to have a good quality of life. And that is going to be greatly impacted by nurses not being overwhelmed by the tasks, the day-to-day things that get done. Then we're able to do the little extras that really provide extra support and love and care for patients. And thank you for listening to my spiel.
All right. Thank you, Emily. And yes, she is my wife. I did not go into that because I'm always of two minds. First and foremost, for this event, she is an expert, and I'm probably going to bug her a lot more than I usually do for this effort, at least for the next year while I'm on contract. All right. So now it's time to hear from everyone in the crowd. Again, I appreciate you all being here, but I want some insight from you. So I'm going to ask you a few questions. You'll have a little time after each one to think about them. If you'd like to share your response, you can put it in the comment section. Number one, are you or anyone you know currently struggling without health care coverage or with unaffordable coverage? So think about that one for a moment. All right. Are you or anyone you know currently struggling without health care coverage or unaffordable coverage? Right, and that can be dental, eyes, and of course the umbrella healthcare coverage. Number two, how is it affecting your life or their lives, physical and mental health, or families' financial security? Right? There's a lot in that question. So how is it affecting your life overall, or if you want to be specific, physical or mental or families' financial security? Right. Medical bills is the number one cause for bankruptcy in this country, and so that, and as I explained during my personal story, I'm thousands of dollars in debt because I can't seem to stop having accidents. All right. And number three, do you believe that someone or that everyone deserves access to affordable health care and coverage? Why? All right. Do you believe that everyone deserves access to affordable health care and coverage? And let us know why. All right. And if you'd like to share more of your comments or concerns or stories, please contact us at Healthcare for All, WV. That's spelled out. All right. And the 4 is spelled out. It's not a number 4, so it's FOR. Healthcareforallwv.com, or dial *3, and you'll be connected right to an operator. All right. And at this time, I'd like to turn it over to Lisa Deal for an overview of the wins that we've had so far.
Hello, everybody. We're really thrilled to have all of you with us, and we're also very proud to be part of the Healthcare for All West Virginia campaign, not just because it's important, but because we're winning. Earlier this year, we passed not 1, not 2, but 3 top priority bills on our 2020 health agenda. It was really amazing to watch it all happen. People flooded the Capitol with phone calls, letters, events, and lobby visits. Personally impacted folks just like you worked with legislators on both sides of the aisle to build strong coalitions around health issues. Some helped organize a bus trip to Canada to save up to 90% on insulin costs, which drew attention to the skyrocketing drug prices in the United States. Others hosted an ice cream social at the Capitol to remind lawmakers about the struggles of West Virginians with disabilities. And hundreds of West Virginians joined together in asking legislators to choose people over profit when it comes to health policy. Thanks to all of these advocates who were people just like all of you, the coalition won the fight to provide dental coverage for adults who use Medicaid. When that goes into effect, it will mean that 300,000 more people in West Virginia will be able to get dental coverage. They will be able to get the preventative dental care, and they won't have to suffer the indignity of having their teeth pulled after it's too late. This is a really huge win for 300,000 people in West Virginia. We won the fight to clear the IDD waiver waiting list, which provides home and community-based services for people with intellectual and developmental disabilities. So that was really due to an outpouring of citizen action at the Capitol. And as a result, the legislature set aside $19.8 million to support all 1,084 individuals currently on that list. And sometimes defeating a bill is just as important as passing one. So the coalition helped once again defeat Medicaid work reporting requirements, which would have led to at least 37,000 West Virginians losing health care coverage. And finally, we won the fight to reduce costs of life-saving insulin. We passed a bill to cap copays at $100 for a 30-day supply. The price of insulin, which is made by only 3 manufacturers, has more than tripled since 2007. So winning a copay cap was a huge step in the fight to make life-saving prescription drugs more affordable for everyone. Medicaid is critically important for so many people in West Virginia, and we need to keep defending it. I'm going to introduce Bobby Lee Messer. Bobby?
Oh, Bobby, are you out there?
Well, it seems like perhaps Bobby is having some technical difficulties. We can move on then.
Oh, Bobby, out there? All right, that's okay. We'll go ahead and move on. Hopefully, Bobby will be able to come back on.
So it seems like perhaps Bobby is having some technical difficulties. We can move on.
Yes. All right, that's okay. We'll go ahead and move on. Hopefully, Bobby will be able to come back on.
So it seems like perhaps Bobby is having some technical difficulties. We can move on.
Yes. All right. At this time, I'd like to introduce Chrissy Kittle. All right. That's okay. We'll go ahead and move on. Hopefully, Bobby will be able to come back on.
So it seems like perhaps Bobby is having some technical difficulties. We can move on.
Yes.
I'm here, but I hear a lot of feedback in the background.
I'd like to introduce Chrissy Kittle. That's okay. All right, Chrissy, are you there?
I am. Can you hear me?
I can. Yeah. Sorry about all of the technical difficulties here. Let's see. Chrissy Kittle is the executive director of the Senior Center in Barber County, and I'd like to get her insight from the perspective of our senior citizens. So, Chrissy, the floor is yours.
Thank you, Adam. So, yes, I am the director of the Barber County Senior Center and the Here and There Transit. Just a little background on what we do for the seniors here. We have a home-delivered meal service, and we serve between 650 and 700 meals a week to our seniors here. And we also do in-home services for veterans and respite for Alzheimer's disease caregivers, housekeeping for certain clients. We take them to doctor's appointments, the store, the pharmacy, or we go for them if they're unable to go. We also have a social worker on staff, which is where we kind of come in for the insurance part of everything. Linda Kittle is here, and she sees several seniors normally. Of course, right now we're not seeing anyone in person, but she is still doing appointments by phone. And she is she's very knowledgeable about the Medicare and Medicaid system, what you're eligible for based on income and based on age and all the different aspects that play into that. It's pretty impressive. I sat down with her to try and learn it a little bit myself, and it's very overwhelming. So I think that's probably the first biggest problem for the seniors in Barber County and anywhere for that matter, is that it's so difficult to understand if you get Part B, Part C, if you're eligible for a break in this, or, how much do you pay monthly for that. So that's a really big difficulty for all of our seniors. So I think the second issue that we really see here is affordability then. So, yeah, you get a raise in your Social Security, and then, you turn around and there's an increase in your premiums for Medicare. So, the little raise you received on Social Security is completely taken away because of the raise for premiums. So we see a lot of people struggling with that. And then, there's, I think for Medicare, there are plans A through N, and people just, I don't know, it's so difficult to understand what you qualify for and which one is best for you. So there's just a lot of issues. So I am thankful we have Linda. She does a great job with it. I think, though, especially for our county, we need to have a little bit better outreach to our seniors to somehow get them more knowledgeable in the fact of what it is that they need and what it is that best suits them for their income. Also, not having a co-insurance, that happens a lot with people. And when you don't have a co-insurance, of course, then you're going to pay more. So there's a lot of issues facing our seniors. I do want people to know, though, that Linda is wonderful and very helpful, and she'll help anyone she can. But I think those are the things that we face as the biggest difficulties in our county. That's it.
All right, Chrissy, thank you very much for that excellent insight. And hopefully with the list that I've gathered here, we can work together to take on some of these issues.
Wonderful.
All right. And next up, we're doing pretty well here for time. We have the wonderful Kat Stoll. She's going to talk about a survey, and we'll go from there. Kat, the floor is yours.
Thank you, Adam. I hope everyone can hear me, whether you've joined us by Facebook or through the phone. Thank you so much for joining us this evening. It's a beautiful evening here. I'm in Morgan County, West Virginia, and I'm Kat Stoll, the Policy Director for West Virginians for Affordable Health Care. I'm going to walk you through what's in the West Virginia Healthcare for All campaign's agenda, our goals, or the planks of our platform, if you will, for 2021 state legislative session. I just want to make a comment up front. I don't know that everybody can see my slideshow, so I'm not going to worry about it too much, but I will mention when I'm switching slides, and if there's someone out there in the tech world who can switch them, that'll be great. If not, you're not missing that much. So I'm a granny. Technology always stumps me, so please bear with. So let's think about what's happening at the federal level for a moment. Absolutely nothing, in my humble opinion. I lived and worked in Washington, D.C. for many years before I returned to my home here in West Virginia. And the gridlock, the partisan gridlock between Republicans and Democrats has really just turned Washington, D.C. into a no man's land where nothing can get done. But it looks much better, folks, at the state level. Republicans and Democrats do work together in Charleston, not always perfectly. And certainly we see, even in COVID-19, a Republican and Democratic divide developing. I mean, who knew a public health mask to protect you from a disease was going to become a symbol of which political party you belong to, whether you wear it or not? That's crazy. But I do think because of COVID-19 and because we're a community here in West Virginia, Republicans and Democrats can work together. And I think the will to work together is greater because of the COVID-19 crisis. So what's in our health agenda? I'm going to talk a minute just about our introductory language. If someone's turning slide 2. What we do at first is we say how important Medicaid is for West Virginia. Do you realize that 1/3 of all West Virginians, that's babies to elderly folks, rely on Medicaid? People who are on Medicare have Medicaid to help them fill in the holes of Medicare. Medicaid is critical to our state. And so our first issue is to protect Medicaid, and you heard from Lisa how we were able to do that last year when the legislature considered some pretty tough requirements that they were going to place on people. Requirements that would have kicked people off the rolls who were trying their best to get back into financial independence. And next slide, please. We also talk about the Affordable Care Act, Obamacare if you prefer. Maybe it's become too much of a political football. I certainly think it has. But if you look at what the Affordable Care Act has done for West Virginia, it's incredible. It is the reason why we were able to do the Medicaid expansion. Without the Affordable Care Act, there is no expansion of Medicaid. We received over $1 billion to help us expand coverage to the uninsured. That's mostly Medicaid, but it's also the premium subsidies in the Affordable Care Act marketplace. And, of course, it's protections against insurance company discrimination against those of us with pre-existing conditions. And I actually don't know a single human being who doesn't have a pre-X. And by the way, COVID-19 will be a pre-X. All of that is thanks to the Affordable Care Act. West Virginia has gained more than any other state in the nation in terms of reducing our rate of uninsured people and having these new protections for those of us with pre-X so that we can't be denied private coverage. So, next slide. First and foremost, what our campaign is about, and especially this year since the state budget may have some real shortfalls in revenue, is protect Medicaid and protect the Affordable Care Act to make sure we don't go backward in our state. And I just want to do a little, call it a commercial break, if you will, for a petition that we have. You may know that the Affordable Care Act, even though it could never be repealed in the in Congress at the federal level, there's a lawsuit which will be before the Supreme Court. In fact, the filings in that Supreme Court case happened today. And ironically, even though we have gained more in West Virginia in terms of more people having insurance, more federal money to stimulate our economy, our Attorney General, Patrick Morrisey, has signed us on to this lawsuit saying the ACA should be repealed in its entirety. And that is what this lawsuit is about. So you'll see, if you can see the slide, that you can go to healthcareforallwv.com. So it's one word. It's all lowercase. It's healthcareforallwv.com, not .org, and sign a petition saying, Patrick Morrisey, you're our Attorney General. Repealing the ACA is not in the best interest of consumers. We're also asking the state legislature to tell Attorney General Morrisey to back off this lawsuit. It's extremely important. We can't afford to lose the ACA, the Medicaid expansion, the protections for pre-existing conditions. So again, if you're motivated, and I hope you are, healthcareforallwv.com, sign that petition. Let's go to the next slide. So it's great to be protecting Medicaid and defending the ACA, but we want to do more than that. We want to move our state forward so that more people have comprehensive, affordable access to the health care they need. So we came together, a number of organizations, and we came up with 7 legislative goals for the state legislature in 2021. I'm going to go through those 7. I'm going to go through them pretty fast. There's more information at, guess where, healthcareforallwv.com. And at the end of my going through those 7 goals that we've set for ourselves, and remember what Lisa told you, we get it done. This campaign, with your help, gets it done in Charleston. We're going to ask you to vote on which ones are the most important. You're going to have a chance to rate the 7 on a 1 to 5 scale. I'll tell you more about that when I'm done. We'll do that. I may mix up the order a little, throw you off, but I want you to try to be honest about what is the most important ones for you. So pay attention, because it's kind of like having a test at the end of this presentation. So goal number 1, plank number 1 if you prefer, create a children's health insurance choice program. There are still kids in West Virginia that are uninsured. What we want to do is allow families who are above Medicaid and CHIP eligibility levels to buy in to the children's health insurance program. It's called CHIP. It's cheaper than regular insurance. It's more comprehensive. So it really is just a way to give middle-class families a new alternative, very cost-effective choice for providing children's coverage. Now, our second goal is a Medicaid buy-in program for adults. And this is really the public option in the state ACA marketplace. It would allow folks to use their premium subsidies, those premium tax credits, to buy in to the Medicaid program, which is a very cost-effective, excellent source of insurance. In fact, I joke that half the state that doesn't have Medicaid coverage has Medicaid envy. They'd like to have that great coverage. Well, this will give private insurers a little run for their money. They'll have to compete with this public option, and it won't cost the state anything because it'll be a buy-in option. And there are some other states trying these ideas. I should mention that. But we would be a real leader if we could move all of these. So item 3, this one's real easy to understand. We want to make sure that women have Medicaid coverage for 1 full year after they give birth. So it's postpartum coverage for women. Last session we got postpartum coverage or the session before last, we got postpartum coverage for women up to 300% of the federal poverty level. What does that mean? It's basically about $37,000 annual income. So women who have a baby, they're covered while they're pregnant, and then their baby's covered, and then they get 2 months of coverage after they give birth. We want them to get a full year of coverage, if not 2 years. And if you think about substance use disorder treatment, postpartum depression, postpartum diabetes, all of these conditions, really you need more than 2 months in the healthcare system. We'd like to have a year, and we might even shoot for 2 years. Okay, I'm going to try to keep moving here pretty quick. Item number 4, which is slide 9, is expand the vision care benefit for Medicaid enrolled adults. Lee's already told you last year we got the dental benefit. Starting January 1, folks will get a dental benefit in the Medicaid program. Until now, only kids did. Adults got nothing dental, which is crazy, right? All of the things that can happen related to disease in your mouth. So we're saying we also need Medicaid to cover eye exams and glasses. Medicaid doesn't cover that right now. And if we want to move people into jobs and into financial independence, it would be nice if they could smile and see at a job interview, if they could go to work and be able to smile and see. And also if they're going to help their kids at home, especially now with COVID-19 where we're all becoming teachers or struggling to learn to be teachers. It is good to have an eye exam and glasses covered by Medicaid. It doesn't cost much. We think this is very popular with state legislators, Republicans and Democrats, and we're really going to push to get this passed. Again, we're trying to move things forward. Our 5th platform item, our goal is to regulate high prescription drug prices. And we passed in the last state legislative session a bill that forces insurance companies and pharmaceutical companies to provide a range of information about how they price drugs. And they have to put that information on a public website. And they're supposed to start it in July. And the information is good, but what we want to do is use that information to create a system of regulation. Right now in our country, we basically do not regulate prescription drug pricing. And other states like Maryland are starting to do this, so we want to move that concept forward in West Virginia. We want to move to an affordability board for prescription drugs. And realize that 1 out of 4 Americans in this country do not buy the prescription drugs they need because they simply can't afford it. 1 in 4 of us struggle to afford our prescription drugs. Okay, goal 6 on our platform is enact paid sick leave and paid medical leave for all workers in West Virginia. Other states have done this. You shouldn't have to choose between going to work and keeping your job or having a day off to take care of a sick child. That's not smart public health. So we want to move this idea forward. It's a heavy lift, but we think that when you need to stay home to take care of yourself or a sick member of your family, you should be able to get paid for that. Now, there's lots of limits and things that we would apply to that, but basically we think it's good for workers and good for small business. And small business supports this. They see it as beneficial to retaining a very productive and dedicated workforce. Last but not least, you thought I'd never shut up, I know, but here's item 7. Our goal is to improve how Medicaid, which serves 1/3 of us, addresses non-medical factors that impact health for Medicaid enrolled families. That's a big mouthful. What it is social determinants of health, if you're familiar with that term. It's things that Medicaid needs to help people with so they can stay healthy, so they can take care of themselves. It could be housing, transportation, food, education. Think about a child with asthma living in a home with no air conditioning. That's tough. The cost of an air conditioner for the child's bedroom is much cheaper than having that child be in the emergency room 6 times during the summer because of their asthma. So the Medicaid managed care organizations, our state, actually support this. We are simply asking to create a task force to start to look at how Medicaid can do a better job of providing funding, actual funding, not just referrals, for these kinds of services that impact your health, but they aren't strictly medical factors. So that's our lineup. I want to do one more quick commercial before I get to our poll, our rating poll. And that is to say, and if you've got the slideshow, this is my key to moving forward slide. And the key to moving forward in West Virginia is federal fiscal relief right now. Because of COVID-19, our Medicaid program is expanding. We have at least 24,000 new enrollees. These are people who have lost their job because of COVID. We're in a recession. There's no question about it. Our state revenues are declining. We need the federal government to be a financial partner to our state and to provide a second bump in the Medicaid federal match so that we get more money for our Medicaid program, and to have funds that we can use to address COVID and to fill in the revenue gaps that our state is likely to see before the year is over. So what I want to ask you to do is contact Senator Manchin and Capito. Don't worry about the House, our House of Representatives folks. Senator Manchin and Capito, they're both pretty good to us. We're asking them to support another fiscal relief package for COVID. Sometimes it's called CARES 2, sometimes it's called CARES 4. And if you can see the slide, it shows a place where you can go to send a letter or contact or call. It doesn't matter, just do it. Senator Manchin and Capito, and say, we need another COVID fiscal relief package for West Virginia. And that website, the shortcut to it, is bit.ly, so bit.ly/WV COVID response, one big happy word, bit.ly/WV COVID response. And I'm hoping somebody's putting all this in the chat box or sharing it on the Facebook platforms where you've joined us. Okay, so that's my little commercial. We really need to get on the ball and push our senators to help us fiscally so that we can move forward a positive agenda in West Virginia. So Adam's story was great. Every single one of us has a story. I want to ask that every single person on this call think about their healthcare story. I have one. I'm not going to share it, but my colleagues, some of them are on this call, know my stories. The most important way to change policy and influence legislators is with a story. My reports with all their little crunchy numbers and data details don't do a damn thing for them. We need stories. Excuse me for that cuss word. Everyone has a story. You can share it. You can go to healthcare. You can go to West Virginia Together for Medicaid, www.togetherformedicaid.com is one place you can go to share your story. Our story collection coordinator, Laura Foster, will contact you, but everything is in your control. When you share a story with us, we let you keep control of it. But if you're interested, we can help you use your story as a tool to help others. So one place you can go to share your story is www.togetherformedicaid.com. We have a bunch of .coms. It's interesting since we're a not-for-profit organization, but www.togetherformedicaid.com. If you can see the slide, there's another survey monkey there for practitioners. I'm not going to highlight that right here, but if you're interested in that, This last slide, if you can see it, has my contact information. I can share more with you about that. My contact information is through West Virginians for Affordable Healthcare's website, wvahc.org, wvahc.org. You can reach me through there. I know I'm taking up a little more time than I should, but I thought we could have some interactive fun. Adam, do I have time to do this? Are we doing okay on time?
Yeah, I think we have just a few more minutes.
Okay, let's do this because it's really important that we get a sense of what folks out there in the state think is their top priority. I mean, I rattled off a bunch of things we want to work on, but what's most important to you? So here's how it works. Technology, my friend, right? Tell yourself that, Granny. Here's how it works. If you're on the phone, you can use your keypad to enter your response. Your choices are to hit 1, 2, number 5 when prompted. 1 being the least important and 5 the most important. So just remember, bigger is better. You can also take our poll on the health agenda goals by going to our website, healthcareforallwv.com. That's no all one word, no caps, .com. And if you're on a Facebook live stream, you can leave it in the comments. So again, 1 is the least important, 5 is the most important. Bigger is better. Question 1. So I'm not going to go through the whole using your key foam head. Y'all are smart folks. You got it. Here's the question. How would you rate the importance of enacting a paid family and sick leave in West Virginia? 1 to 5. 5 most important. Rate that for us. Let us see where it lands. And remember, you're going to vote on all 7. Don't just put 5 on every single one. Give us a sense of what is most important to you. If you got to do 5 on every one, I understand. That's probably what I'd have to do. So here's question 2. How would you rate the importance of regulating high prescription drug prices? 1 to 5 scale. You're seeing a pattern here, right? Okay. Again, let's use those phone keypads. On a scale of 1 to 5, how would you rate the importance of expanding Medicaid to cover moms for 1 full year after they give birth? And we're going to go on now. How would you rate the importance of creating an affordable Medicaid buy-in public plan option on the Affordable Care Act marketplace? This would be for families who make too much money to qualify for Medicaid, but they could use their premium tax credit or subsidy to buy in, if you will, to Medicaid, to have that as another plan option. Remember, 5 is the most important. And if you're struggling with this, we'll try not to go too fast, but I'm going to ask you to rate the importance of creating an affordable CHIP buy-in option so there are no kids left in our state who do not have quality affordable insurance. A CHIP buy-in. And again, the beauty of a CHIP buy-in, it doesn't cost the state anything, but it gives families a really quality plan at a lower price. 1 to 5, where do you rate it? And next, how would you rate the importance of expanding vision benefits for Medicaid-enrolled adults so that they can get eye exams, glasses, and routine eye services? So a vision benefit for Medicaid-enrolled adults. That's question 6, 1 to 5. Bigger is better, 5 is most important. And question 7, last but not least. Using your phone keypad or going to healthcareforallwv.com or putting it in the comment section of Facebook, on a scale of 1 to 5, how would you rate the importance of using Medicaid money to pay for housing, food, education, and other non-medical factors that impact health and recovery? So it's coverage of social determinants of health, non-medical factors by the Medicaid program, 5 being the most important. Please rate that. And that's going to help us see how you rate those. And what comes to the top for you helps us know where our priorities should lie as we work with the state legislature in this upcoming session. And whew, that was a lot. I hope that was helpful. And I really am so grateful for all of you who joined by phone or Facebook. And I'm going to turn it back over to Adam.
All right, Kat, thanks for everyone still on the call or on Facebook. We appreciate your time, and Kat has certainly given us a lot to think about. You can take the poll. If you take it by 8:30, again, your insight is the most important aspect of this meeting. So take that poll. There's a $15 Walmart gift card at stake. All right, so we're going to raffle that off shortly after 8:30. And from there, if you want to learn more about our cause and our movement, go to healthcareforallwv.com/join. All right. And I'd like to thank West Virginia Citizen Action, West Virginians for Affordable Health Care, West Virginia Center on Budget and Policy, West Virginians for Affordable Health Care, and all of our excellent panelists, all right, for their insight. Thank you all for being with us, and we appreciate your time and attention. Have a good evening.